Obsessive-compulsive disorders and that whole class of related disorders. We've been going over some of those. I'm now going to summarize the obsessive-compulsive disorders. I'm Cristi Bundukamara, Dr. B. I am a psychiatric nurse practitioner with over 20 years of clinical experience, and I am going through demystifying the DSM. So, obsessive-compulsive and related disorders is a group of disorders that has to do with that persistent thoughts and compulsions. So there's two that we haven't discussed, and that is substance or medication-induced obsessive-compulsive disorder. This is when you are using a substance like cocaine, methamphetamines, or a medication that an ADHD stimulant medication can cause this, that you develop an obsessive-compulsive disorder as it results to using that substance or that medication. The treatment for that is to stop using the substance and or talk to your doctor about discontinuing the medication. Then there's also medical-induced obsessive-compulsive disorder, and this is when there's a clinical reason that we are seeing these symptoms. So maybe an abnormal MRI or abnormal lab tests that are affecting the brain. And so we treat the underlying cause in the medical-induced obsessive-compulsive disorder. And so those two are kind of lumped together here because you need to talk to your doctor about the symptoms, that they're physical. Let's get the underlying cause taken care of. And hopefully that there's not an obsessive-compulsive disorder that develops. True obsessive-compulsive disorder typically develops somewhere between the ages of 14 and 19. And that is kind of the true obsessive-compulsive disorder. This is those persistent thoughts, and they are dysfunctional, and you can't get them to stop, and you feel like you have to do the compulsion in order to feel relief. You do the compulsion, you feel relief, then the cycle happens again. We have a whole video on what is obsessive-compulsive disorder and how we treat that. Body dysmorphic disorder is also in this cluster of obsessive-compulsive disorders. So this is the persistent thought of something is wrong with my body and this deep desire to do something about it. Now, not everybody can do something about it or does something about it. This can be comorbid with an eating disorder. We often see in anorexics that they truly believe that they're fat, although they are 85% of their ideal body weight. But we also see body dysmorphic disorder in a specific physical thing on your body, okay? And so there's this persistent thought, let's say it's your nose or somewhere on your legs, and there's this persistent thought that you hate it, you don't like it, it's ugly, and you have the desire to do something about it, to cut it off or get plastic surgery or those kinds of things. So those are the first two, obsessive-compulsive disorder, body dysmorphic disorder, and we have a whole video on body dysmorphic disorder. Hoarding is also considered an obsessive-compulsive disorder. And this is because there's this persistent thought of, I need this, I need this, I need this, I can't throw this away. And so the compulsion is holding on to things, not letting physical things go. So the persistent thought is, I need, what if? And then the compulsion is holding on to that. And that also, we have a whole video specifically on hoarding. Then the other one is trichotillomania and excortation, which is skin picking. And I have a video with these together. And the persistent thought is not always known in this one, but it is considered an obsessive-compulsive disorder. Oftentimes my patients will tell me, I don't know why I'm picking my skin. I don't know why I'm pulling out my eyebrows or my eyelashes or my hair, right? But there is some underlying anxiety that we probably should go to therapy and figure out what those things are. But the reason this is an obsessive compulsive disorder is because it is highly compulsive. They do not feel like they can stop pulling out their eyelashes, pulling out their hair. So these, as a cluster, obsessive compulsive and related disorders, as long as there's not an underlying condition or substance use, the treatment in general is always starting with kind of antidepressants, and sometimes antidepressants at very high doses for obsessive compulsive disorder. And the reason that is because the theory is that it is low neurotransmission. And although this is not depression, low neurotransmission is treated with antidepressants because antidepressants, most of them are serotonin reuptake inhibitors or norepinephrine or dopamine. And if you stop the reuptake of those, you have more around in the brain to be utilized for that decision making and to try to stop those persistent thoughts and the compulsions. So that concludes our obsessive compulsive and related disorders, DSM, demystifying the DSM. You have a great day, and I do believe this is treatable and that you are mentally strong. If you got to the end of the video, you obviously enjoyed some of the content. I have a lot of free content out there. I am really trying to empower everyone to find their mental strength. So subscribe, get the actual notifications, and let's embrace this journey of mental strength. See you there.